So in part one, I talked about three things that I hated about being an ICU nurse, but the thing is, I didn't hate being an ICU nurse. So let's talk about three things that I loved about it. Number one are the patient and family interaction. Obviously, our patients are mostly intubated and sedated, so it's a lot of a one sided social interaction. But it is such an honor to show up for people when the scariest thing that has ever happened to them or their family is going on, and you get to be the eye of the storm for them. Nursing can be such a thankless job, but generally speaking, I felt like the work that I was doing was so appreciated. And I love the communication challenge that it is to navigate someone through their critical illness. It takes brilliance to explain multi organ failure, or advanced hemodynamic monitoring and management, or freaking ECMO to people who have never stepped foot in a hospital before. Getting people from a place of being so afraid watching us work on their family member to understanding what all of the beeps and buzzes mean and feeling a little bit better about it is so satisfying. Patients in the ICU are sometimes sick for so long that you really become part of the family. I knew going into it most of my patients would be sedated, so I didn't expect to love that human aspect of it, but I really, really did. I think number two is the autonomy. I was really practicing at the top of my license. So much of critical care, at least where I've worked, is nurse driven. They would bring me a patient from the operating room after open heart surgery, and I'm the person who's waking them up from anesthesia, controlling their pain. I would work with the respiratory therapist and we would independently extubate them. I was the one monitoring and managing their hemodynamics minute to minute and hour to hour. I didn't need to ask permission from a provider to care for my patients. If I saw a bad blood pressure, I treat a bad blood pressure. And as a rapid response nurse, I had so much discretion in managing patients. I could order chest x-rays, BiPAP, fluid boluses. Doctors and other members of the team sought out my opinion and it was valued. The things that I had to say altered the care plan, and I love that. And finally, I just think the medicine is fascinating. You're thinking about disease process layered on disease process, of organs not failing in isolation and how they affect one another. I got to experience real-time application of pharmacology. I could titrate my own drips. I ran advanced life support devices. I was the person managing a patient's continuous hemodialysis, or their balloon pump, or their Impella, or their ECMO. I got to develop expertise in managing the sickest of the sick patients while their chest and abdomen is open and we're pumping all of their blood volume outside of their body. And as an incurable nerd, it was awesome because there was always something else to learn. Because critical care is not just one specialty. I was a medical ICU nurse, and a trauma ICU nurse, and a cardiovascular ICU nurse, and a neuro ICU nurse, which means I got to do the cool stuff across the spectrum of what can go wrong with the human body. I might be in there with a neurosurgeon on Monday drilling holes inside some guy's skull at the bedside, or down the hall with a cardiovascular surgeon cracking a patient's chest open at the bedside. I got to use my brain to do the high energy and life-saving stuff that I always dreamed about doing. I got to make the close catches where my assessment and my judgment is what made the difference for a patient. I've placed my two hands on a person that is dead and watched their heart spring to life back in front of me. Like, there is nothing like that feeling. It is the coolest thing in the world. You ever do that at your desk job? Like, I don't think so. And you're surrounded by such smart people that are all there for the explicit purpose of saving people's lives. Yes, it sucks sometimes, but it is such a cool job.